Hi, everybody. Welcome to Talking Data Equity for Friday, September 19th. And my name is Heather Kraus. I am extremely excited that you have found your way here to Talking Data Equity, whether this is your first time or whether you are a regular. It means the world to me that we have a community where we can come together and talk about the reality, the concrete, demonstrable ways that we can make sure that we're doing science and doing data projects in such a way that our results are rigorous, useful, accurate, and aligned with our community values and our equity goals. And that is the purpose of Talking Data Equity. And it's also the purpose of the company that I founded, which is called We All Count. And We All Count is the one that brings us the resources for Talking Data Equity each Friday. And the Zoom link doesn't change. So now that you've found your way here, you will be able to find your way back to any of our Talking Data Equities. We have them most Fridays, not every single Friday, but most Fridays. And in the chat, I put the link to where you can find out what's going on this Friday and all the Fridays that are upcoming. And you can decide whether it's a good fit for you. We always love to see you. And you can find all the recordings and all the resources that we're going to be sharing. A lot of resources. We're going to be mentioning a lot of resources during the talk today. And we're going to be sharing all the links to those resources, as well as the links to the recordings in our data equity forum. Link in chat. That's a free public good. So you can make your way over there. And that's where all the resources will be in a couple hours from now. So highly recommend just settling in. We have an amazing guest speaker and you will get all the links in a couple of hours. So while our guest speaker is sharing her stories and her experiences, we ask that you keep your microphone turned off and feel free to use the Zoom chat. You can share reflections, share questions, feedback. I'll do all of that using the Zoom chat. And then if we have time, we will give you a live Q&A where you can kind of raise your hands and ask questions. But feel free to use the Zoom chat while our guest speaker is sharing her story. Okay. Now, our guest speaker today is somebody that I am a huge fan of. People who know me well know that I absolutely love graphic novels and comic books. And when I found the comic books of Meredith Li-Vollmer, I was blown away. And then when she agreed to come and share her work with us, I almost just passed right out. So Meredith Li-Vollmer is the content and risk communications lead at Public Health in Seattle and King County. She also has an affiliation with the University of Washington School of Public Health. And she has served in multiple capacities at the national level in the public health field, including at the National Academies, the National Association for County and City Health Officials, and the Center for Health Security at Johns Hopkins. And on top of all of that, Meredith is a cartoonist and on the board of Short Run Comics and Arts. And her comics have been published in The Stranger, Mutha, Illustrated Pen, the American Journal of Public Health. And she has at least 2 comic books that we will absolutely link to that have won multiple awards and will blow your mind. So enough from me. Meredith, thank you so much for making time. I know it's first thing on a Friday morning for you. And thank you for joining us. I'm turning it over to you.
Thank you so much for having me. And it's just wonderful that there's a community to talk about data and health equity. So I'm really happy to be here. And, it's in the title that this is about public health, but really I want to emphasize that I think that these approaches can be used in a lot of other fields as well. Because really what I'm going to talk about today is about why comics really work. When you're communicating about complicated topics. We're going to talk about why human stories really matter and how I think it can draw people to data-driven and science-driven information. And then we're going to talk about my thinking on why I think comics hold so much promise for talking about picture issues. So let's get into it. And we all know this. I don't think I have to explain this at all to this crowd that communicating about health and science is more challenging than ever. Anybody who was following the ACIP vote yesterday about vaccines knows that, we are just in a totally different world, even since last year. Here, this is a comic strip that I drew of myself, talking about how public health is a real hard sell these days. I drew my daughter when she was 13 to stand in for the American public, because, this was a comic strip I drew as we were coming out of the pandemic, and nobody wanted to hear from public health anymore. Everybody was tired of all the mandates and the social distancing and the masks and the vaccines. Um, so that compounded the challenges we've always faced in trying to explain and engage people in things like epidemiology and helping them understand it and also connect to it. And that's where I think comics can really help us. So my origin story with comics was really in 2008, when I was hired to do pandemic planning for the health department in Seattle. And in doing that, I was trying to communicate about this potential of a pandemic that people really couldn't get their heads around. And so I was reading this book called Understanding Comics by Scott McCloud, and where he talked about how people construct meaning from this combination of distinct characteristics that the comics medium has. And I thought, well, there's something to this. And so I thought, people, the only time I feel like people are really even vaguely interested in this topic of a pandemic, which they've never really heard about or thought about, is when I talked about 1918 and what happened in the so-called Spanish flu. And people were really stunned to hear about it. And so I managed to get some funding from our preparedness unit, and we created this comic book with an artist named David Lasky about what happened in 1918. And within that comic book, we also talked about the potentiality of a future pandemic. This was 2008. And so we thought, people really can't understand how devastating this could be. So let's try and make this a little more concrete for them. Let's illustrate what this could look like. So now in 2025, these are all very familiar scenes of closed workplaces and large events that were canceled and crowded healthcare. But this was a way in which we were trying to use this medium to try and make people understand at a glimpse just how bad something like a pandemic could be, and then to try and compel them to think about what might happen, what we can do to be more ready. And really, it was about mental rehearsal, trying to help people understand what could happen so that they would be more prepared for it when it does happen. All right. So at that point, it was kind of a slow build to the development of more comics. But really, I think our communicable disease unit and our emergency preparedness unit really backed me on some of these ideas. And I think one of the reasons why we've turned to comics is because they have a lot of explanatory power in a very dense, economical way. So here, this is a panel from our comic. It's like a handout page about norovirus, right? And so you can look at this and you can pretty quickly understand what the key symptom of norovirus is. And so, having that illustration really can make information very easy to grasp quickly. But what makes comics different than just illustration is that it's not just illustration, right? I think that's what people think of a lot, but that it's image and text. That text can be narration, it can be dialogue, it can be exposition. So here, you could see just with the illustration alone that you could understand some basics of how germs are transmitted from the flu, right? But then you add a little bit more text into there. So you've got the sound effect of the sneeze and the little bit of explanation. Flu germs spread when people cough, sneeze, or talk. If flu germs get on hands, they can pass the germs to other objects. So that's adding more clarity about germ transmission, which a lot of people didn't understand exactly, especially the touch part of it when we were working on this particular document in the mid 2000s. All right, so comics add a lot of that kind of explanatory power. And I think then when you start getting into more complicated health issues, you can use a lot of different elements within comics to help explain it. So what I'm showing here is from a comic strip. I'm going to hold it up here. Why testing for lead helps kids and their growing brains. And I developed this with our lead and toxics unit because there are particular populations within our county that are really at much higher risk for lead poisoning. And that's because there was a copper smelter that put toxins into the air and into the soil. That's into the city to the south of Seattle. There's also lower grade housing that has a lot more lead in it. And there are also products that particularly come from overseas that people bring with them into the country that don't meet the US standards for toxics. And so they may have products in their home that actually expose them and they don't know about it. But when you're trying to talk to people who are really affected by this issue, families, because really we were trying to communicate to parents because children are the most at risk, because it affects their brain development. The parents have a lot of other things on their minds. So really trying to urge them to get their kids tested for lead, really is not going to be a big priority. So we created this booklet to try and draw more attention and to be able to have something that could be handed out at health fairs by community organizations. It's translated into a lot of languages. So here we used elements of comics to try and make this more understandable. So first of all, there's a text that explains what lead is and that it's poisonous if it gets inside your body. We really tried to connect this to young children by having Amy Camber was the artist and she did these very sweet drawings of children. We also picked a palette here that was soft and colorful at the same time so that it was more inviting on a topic that is not inviting and that it really kind of evoked young childhood. And then we put this illustration of the brain right at the beginning of the comic strip because parents do care about children's brain development. Lead may be too abstract, but brain development is something that matters. And we were also using image and text to show people what might be in their household that contains lead, right? So I asked the team that works on this, can you give me some reference photos of these things that might have lead in them so people know what we're talking about here? And when they showed me these reference photos, they showed me, they had these dishes, and I looked at them and thought, oh my God, I have those bowls. I have those spoons. They were my grandmother's. And they said, get them tested. And so I brought them in and they tested them and, they were off the charts in terms of lead. And I thought, okay, this is the same aha moment that I want people to have when they look at this comic, where they can see at a glance, oh, I have those bowls. I have those spoons. Now I'm concerned. So that the image and the text there was important. But there's also sequence, right? We talked about how comics also have sequence. And I want to show how sequence can work in a couple of different ways. So when you look at this first panel, sequence happens within the image. So parents often think, well, if the problem is because kids are ingesting lead, how can they be ingesting lead? Like I don't feed my kids lead. So we were showing here that there can be a lot of lead in old paint. And so with this hammering, the sequence is from the illustration of how that dust is falling, and the dust is falling on these objects that in the next sequence, the children are then putting those objects in their mouths. So this is a way in which we can show consequence. And I think that's really important when we're communicating about health and science, of how one thing leads to another. So this is a more recent comic strip that I did, was it last year or the year before? Where we were having we had a small measles outbreak. And, measles is one of those diseases that because people have been so well vaccinated for decades, that most of us have no memory of what measles is like. So it's actually quite unfamiliar to people, and they have no idea how terrible it can be, and also how very, very contagious it is. And so we wanted to be able to explain that to people, and that to explain how are we seeing measles come in, because it primarily comes into our country through travel, right, as the first index cases. So this was a comic strip where sequence was really important because we're showing here that we have somebody who's traveling through our airport. He doesn't know that he has measles. He hasn't been vaccinated. And so he feels terribly, but he doesn't know what it is, and he goes in. So this allowed me to draw this miasma, right? All the viruses just hanging out in the air. And so he's in this crowded waiting room, and we wanted people to understand, what these risks are here if you're not vaccinated, so that even after Joe leaves, we could show these viruses are still hanging out in the air, in fact, for up to 2 hours after he has left the room. So then you have all these people who are exposed and have no idea. So then it also allowed us to show that if none of these people had been vaccinated with MMR vaccine, then up to 9 out of 10 of them would get the measles. But if they were all vaccinated, most likely no one would get the measles. So we were able to show how it spreads, how contagious it is, how it hangs in the air, but also the real value of the vaccine. We did that in essentially 7 panels plus a little bit more information at the end, right? So a very concise way. And again, a way in which we could have it translated, in which it works for people who are at lower literacy levels. We try and get these translated into a lot of languages, but we aren't able to do every single language in our area. So again, having visuals is a way that we can better reach them. Okay, now we get into my favorite part though. So up until now, the kinds of comics I've been talking about have really focused on a lot of clarity of information, of using it in a very educational way to explain about a health issue. But I think what comics offers us that other kinds of communication media don't do, video does this well too, but that you can really focus on human stories. And I suspect you talk about that in this group. Um, especially when we're having so much trouble, I work in communications for our public health department, getting engagement on our issues beyond the people who are already engaged in public health is increasingly difficult. And there's real hostility out there towards us. And so, how is it that we can get people to connect into these issues that we know are so important? And people do relate to personal stories more. And so the degree to which we can use personal stories to convey the health information, I think creates that connection that draws people in and gets them to engage. So this is a comic strip that I did. I was asked by The Stranger, which is a local alternative weekly here in Seattle, to do a comic strip. This was in 2021. So we were still in the pandemic. This was about the Delta variant of COVID. And we have gotten that first wave of vaccine in. Everybody was feeling optimistic. So we're able to convey that. And so here we have a running timeline. For those who may not know, Seattle King County was the first area in the country where COVID was identified. So for our emergency response, we were at day 542 in this comic strip. And so, we're trying to acknowledge the fatigue people were feeling, but the joy of getting that vaccine. And then you hear that there's something out there, that people are still getting COVID. And that feeling of kind of betrayal, like, I got vaccinated, how can this be? And so I was trying to use that in this comic strip to be, transparent about, yeah, people are getting sick still. So what is going on? And to show the outrage that people might feel, like, what's up with this? I got the vaccination. Because I think as a risk communicator, we talk a lot about how until people know that you get how they're feeling about an issue, they are unwilling to listen to any advice you have to give. And so how can we show that? And so I tried to show that through the people and their reactions to knowing that they could still get COVID, right? So then we have a conversation happening between two friends. And we have some explanation that most of the time the vaccine is very good at keeping people from getting sick. And this was again 2021 as we're still learning. But no, vaccine prevents infection 100% of the time. So we have two friends, one of them saying, then why get it? And the other is saying, it's like birth control. Even if it's not 100% protective, you'd still use it, right? And then we get to the main point, which is the vaccine is extremely effective at preventing serious illness, hospitalization, and death. So, this is the use of story to get across information that people don't really want to hear. And more recently, so this is from last year, I started a series about long COVID. And I wanted to do this series because I think long COVID is something that hasn't gotten a lot of attention. Everybody's got the COVID fatigue on information. And there is a real lack of awareness that long COVID is real. And in talking to people who have long COVID, the sense that they were being gaslit, sometimes by healthcare providers, that people didn't believe them, that their friends and family couldn't understand why they weren't able to participate in the way that they had before, and how hard that is for them. And so I wanted to be able to tell some of those stories to help build empathy for what people are going through, and also to use that emotional weight to help people understand, there's still really good reasons that we need to keep up with protecting ourselves from COVID, because anybody could get long COVID. And I wanted them to understand that this doesn't just happen to elderly people. This is people who might have been previously healthy. So we did a series of stories about people who have long COVID. So this one is about Deepa, and these people very generously shared their stories, but about how this relatively young woman, had a pretty mild case of COVID, but then a little bit later developed these new symptoms that utterly debilitated her. She had to, essentially, she had to leave work for a while, and then she came back. She had a workplace that accommodated her. But one of the things we also wanted people to know is that people should be accommodated for this because it's considered a disability. So to create some of that empathy and awareness of, this is really so difficult that she can, barely work a half day, that she has to lie in bed while doing work, right? So this is kind of the direction that I really am interested in going with comics. I think also that one of the power of comics is being able to capture elements of the people who you're hoping will read the material. So this is a comic book that we did. It's a little mini comic book. Here it is in Somali. So we like these little small hand size ones that are, kind of fit in your hand and are relatively easy to print and cheap. But this one was after we were working with colleagues at the University of Washington, who found that the people who were coming into the local EDs during heat events for heat illnesses, and we're talking about not just like heat stroke, but also cardiac arrest and strokes and things like that were really triggered by the heat, that they were, it follows the social determinants of health, right? So that they were people who were living in housing where they didn't have air conditioning, sometimes couldn't even open the windows. They were living in neighborhoods that didn't have as many trees. They were largely from immigrant and communities of color. So we created this comic to try and let them know what the risks are, because some people come from hot climates, right? And they don't think Seattle is a place where you have to be concerned about that. But there are attributes of our area that when heat hits, because we don't have air conditioning in a lot of buildings, and because there might be conditions where it's not that hot, but it doesn't cool down enough at night, right? So we wanted people to know that there is risk, and that it's particularly for certain groups, they really need to think about staying cool, whether it's people who take certain medications, whether it's age-related, whether it's working outside. So we used comics to illustrate this, and we really tried to work with our community partners to incorporate cultural practices that people already use to cool down, to make the images reflect the communities that live here in King County, Washington. So you'll see that working with the artist, David Lasky, that he met with members of the Somali community. We had reference photos so that we could try and make it look authentic. We talked to them about where is it that you would go? Our original illustration for trying to go somewhere with air conditioning on a hot day included movie theaters. And then we heard from our community partners, do you know how much movie theater tickets cost? We are not taking our whole family. It costs too much. So then we tried to think about what are more reasonable places with air conditioning that we could direct people. And then here, I love this panel because we talked to people about what do you eat when you're trying to stay hydrated. And there were members of our Chinese community who talked about winter melon soup. And my grandmother always drank winter melon soup. She lived in San Jose, California. And I always thought, why are you drinking soup? It's so hot here. And I have learned that, oh, it has hydrating qualities. And there is like a particular porcelain set that's based on the melon seeds that my grandmother also used to use. So we got the artist incorporated that into the illustration. And so one of the things we did with these comics is we put them into community media, bilingual media, what some people call ethnic media. So here you see it in Vietnamese. And you know, of course, comics work brilliantly in newspapers because that's the medium they came from. So we were able to place ads with this information in translation. And when we did that, we heard from the publishers, in particular, the publisher for the Seattle Chinese Post contacted us and said, whoever did this knows something about our community. So I feel like this is a medium that allows you to reflect back the people you're really trying to reach and help connect with them through visual ways. And you also see here, this is a something we put out during COVID about staying safe within the home for seniors back before there was vaccine, right? And we really wanted to help them know what they could do to feel connected, to get exercise. So these were these kind of brochures that we put into, we asked to be put into bags, food bags that came out from senior centers. So that was another way in which we tried to use comics to provide visual information. All right. So this particular comic strip I'm showing, because it went, it went really viral. And it's about what to do if a rat comes up your toilet, which is a thing that does happen. And we put this out. Well, there was a serious flooding event. It didn't affect a huge number of people, but it did cause all this water, you know, to come into homes and also allowed critters to go into sewers and so forth. And so we put this comic strip out. So what you should know is a dish soap is your friend. So you see dish soap here is the superhero because that you squirt that, you put the lid down. This is me, by the way. The original version of this, I was much more hysterical, but we thought that's not going to be helpful. But if you squirt that dish soap and it gets in the rat's fur, they're no longer buoyant. So that if you start flushing it without the dish soap, that rat may not go down. But if it's got the dish soap, it's more likely to go back down from whence it came. So part of it, so this, when this came out, we got thousands upon thousands of views on our various platforms of it. They talked about it on our local NPR station in their Week in Review section. It got mentioned in the local TV news. They showed clips of it. So part of it is the topic, right? That rats and toilets kind of sell themselves. But, oh, and also This American Life reached out to me. It didn't make it into their rat episode, but still, it's kind of exciting for a moment. But I think part of it was the novelty that it came from the health department, like the health department's going to put this out. And I also think the fact that it was hand drawn makes a difference because in health departments, we're all using Canva in particular. There's more sophisticated graphics available to us than we used to have, which is great. It makes very professional looking graphics. But I think when you're trying to attract attention when people are scrolling through Instagram, that when it's something that's hand drawn, people stop. You know, they're getting used to AI, they're used to Canva style graphics, but something hand drawn can draw attention. So I did a little experiment um, that about wildfire smoke, where we had put out some really well done slides, I thought, about the importance of keeping indoor air clean when you have wildfire smoke outside. And so there was a wildfire smoke event. We put those slides out, got pretty modest traction, 27 likes, 6 shares, 1,200 impressions. And then the next smoke event, I did it as a comic strip with me and this grumpy cat talking about the same kinds of information, but in comic form. And it got, 1,250 likes and 443 shares and, 14,000 impressions. So, I do think that there's something about that hand-drawn quality and story, not, element that people are much more likely to engage with. So I think I mentioned already that the direction I'm interested in going is doing more personal stories and telling stories about health that come from the people who live in our community. We're doing a series right now about the people who do work on gun violence prevention within their neighborhoods. And that's something that I've been doing with my colleague Ariana Donneville. And it's, I think, like a great use case for using comics to talk about that. This is another one that we did this year, and this one is about domestic violence and heat, and it was part of the Climate Health Equity Initiative in our department. And we had been meeting with a group of community advisors talking about climate change and equity. And we were saying, what are some stories that you would like to share about your experiences already living through climate change? You're at the front lines of climate change. And one of the people in that group wanted to tell her story, and she is a survivor of domestic violence. And she talked about how when the weather became extreme, especially with heat, that her abuser became more violent. And she wanted to tell this story because she also wanted other immigrant women like herself to know that there's help, because at that time she did not know that this was domestic violence. And she felt pretty hopeless at the time. And she found help, and she wanted others to know that there is help, and this is an experience that you're not having alone. So we worked with her. I interviewed her. We developed a story together. She always had final say because, we were also concerned for her safety. So we changed how she looks. We changed her name. We changed details about her life so that she would not be identifiable. And that's another thing that comics has allowed us to do, because it's really hard to get people to share their personal stories, especially on the social media that can be very hostile. So we can change things. So it's not about them directly, even though it's based on their experience. And I think that it's also a way in which we can bring new perspective to climate change, right? Already we were trying to help people make that connection between climate change and health, and how, our health is really impacted in so many ways by climate change. But maybe domestic violence is not something that people connect with it. So I feel like that it's a really useful way to introduce these topics. And I also came across a study by somebody in the UK, Sarah McNichol, who had done some in-depth interviews with people who were reading educational comics about a health condition that either they were experiencing or a loved one was experiencing. And it was a qualitative study in which she found that in talking to them, comics helped them be able to relate to, respond, and remember information better than if it was offered in a more abstract way. So I think there was brochures and other kinds of flyers that the same information was presented in. And then interestingly, she talked about how visual metaphors provided avenues for them to understand their own health conditions from other perspectives. And so it prompted them to reflect more and re-examine their own understandings of their health condition or their loved one's health condition. So I think that there is so much power in visual storytelling because we're able to use that emotional and empathetic quality of comics to help people see things in new perspectives or from multiple perspectives. And that we can use that emotional pull of the comics to bring urgency to issues. Urgency to issues like climate change, urgencies to issues like measles vaccination. So here's another comic that we did with a really different illustration style about, it's called Climate Change is Health. And we did this several years ago when we were trying to help people connect to climate change as a health issue, because I think people commonly associate climate change as a very wonky topic, as one that involves greenhouse gas emissions and carbon credits. And so people just don't really connect to it. And we wanted people to connect back to the human that's at the center. You know, people are at the center of climate change, and what it's doing to our health is at the center of climate change. So we created a comic that talks about the different ways in which climate changes our health. It changes the air we breathe. It changes our exposure to disease carriers. It changes our mental health, how we feel, right? So we had a mini comic about this. And what I like is that you're able to draw people in by talking about showing people at a very personal level, the kid with asthma, right? And you're able to draw them in and connect to that issue. But then in so doing, you can also then take that and bring them back out to the big picture and to say, this is a common problem that we all need to work on. This is something that affects us all. And then you're bringing it back upstream to population health. And you're taking this complicated issue and talking about, you know, this is something that affects our personal health. And there's something we can do about it. We can look at systems and institutions. We can ask for policies. And, you know, so I feel like that's a direction I'd like to try and experiment more with, to see how we can start with the personal and bringing it out to the big. So yeah, this was the end of the comic strip that I had done, which talked specifically about how we can use comics to connect the personal story to the bigger picture. This one was using the example of toxic fish that is in our waterways, and helping people connect to that kind of, you know, big picture issue by talking about what it means to people who fish in our local waterways and ways in which we can get engaged in changing that. I do have an Instagram at Graphic Public Health where I try and post, you know, public health comics. And then I have a book that talks more about how to do this. I highly recommend the organization Graphic Medicine, which talks a lot about the medical field, but also public health. And there's just a lot of engagement from around the world in the graphic medicine community. So there's a lot of different ways to tap into that, whether it's through their social media, whether it's going to their occasional conferences. But there's so many people who are doing this work, and it's really, you know, kind of exploded. So some of you may have seen some of the graphic novels that are out there that deal with health. There's so many of them. There's so many good ones now. So there's a lot of ways in which you can explore this. If you're interested in using comics, I really suggest that you start reading some of those graphic novels, because, you know, then it will help you understand how we can use story, and how we can use very human stories to talk about science and health.
Thank you so much, Meredith. I'm sure that you can sense and hopefully see on your screen and maybe in the chat how much appreciation there is for this talk. This is exactly the kind of like hope and concrete examples of health equity that we really needed today. And there is a number of questions in the chat. I want to say first, before we get to any questions, that we will post resources at the link in the chat. And there's already a couple of people asking for recommendations for graphic novels that have to do with health. And if you have some, put them in the chat. As I said at the outset, I'm a huge graphic novel nerd, so I will put my whole list into the Data Equity Forum, and you can support all the independent booksellers in your neighborhood and get those. So all of that will be in link form in the Data Equity Forum. The other thing I want to say before we get to the questions is I'm so happy that you called out graphic medicine, Meredith, because I am not in graphic, like I'm not an illustrator. I just really, really love comics, and I'm not in medicine or public health per se. But I recently attended the graphic medicine conference and learned so much and was welcomed so warmly that if you're at all interested, even if you're not in public health, I would highly recommend getting involved in that organization because it is fantastic.
Yeah, I have to say that when I think I first went to one of the conferences in 2010, and it was much smaller, and I had no idea that there were other people doing this kind of work. But yes, very welcoming. There's a lot of librarians who are involved.
Mhm.
There are a lot of academics and artists and people who are telling their own health stories and just want to connect with others who are doing that. I also want to say that I was not a cartoonist when this was not a path I expected to take at all. I hadn't really drawn since I was a teenager. And I started out writing the comics and scripting them out and storyboarding. And then, I connected with a group of local artists here who really encouraged me to start drawing them on my own. And it was, I mean, that was a real challenge for me to have the confidence to put my own illustrations out there. But I really feel like I've thought so much about the health issue that I feel like, even if my illustrations are not as professional as trained artists, I feel like I'm still able to really connect to the emotion within the health issue because I've thought so much about it, and I am a communicator, so that helps.
I really agree with what you've said there. How important it is to the extent that your resources and time allow you that you do those illustrations. I love the illustrations that you do. And for people in the chat who are saying, I have no training, when Meredith and I were getting ready for today, we shared our common love of the comics genius, Linda Berry. And Linda Berry, again, we'll put links in the chat. Links in the Data Equity Forum to all of this, has a really, really good book that teaches anyone how to make really, really, really good comics in a couple of just some day-to-day exercises. So we'll link that. Linda Berry, yes, swoon, exactly.
I do see in the comments that Rachel's asking about how we disseminate. And I think that that's, a really good thing to talk about because I have to say, with No Ordinary Flu, we got big funding from the National Association of County and City Health Officials to do a giant print run, but we didn't have a good distribution plan. And it got sent to all these, like in the Office of the Superintendents of Public Instruction in Washington State, ordered them for all the middle school students in the state, but with no curriculum plan. And also we all know, I think, that teachers are overburdened and they didn't want these because they didn't know what they were supposed to do. So that was a big lesson in having more of a distribution plan. So the primary way we get most of these out is digital now. That we put them on our Instagram. They do very, very well on Instagram. We put them on Facebook, and and we put them on our blog. So that also is another way of getting it out digitally. We have a number of them available for download on our website. I think we can do a better job in trying to make those more available. But I also really like, so this is a new one we've done. What are PFAS and why are they harmful? So it's about the PFAS forever chemicals. And so, again, we like to do these little mini comic books because they don't take up a lot of space. This is it in Chinese. And we can distribute them to our community partners. We have them at, health fairs and things like that. The libraries will often take them, clinics, so to put in waiting rooms. So, there's a variety of ways in which we try and get print copies. So here's one of the long COVID stories that we just got printed up. And so I'm giving a bunch of them to the University of Washington long COVID clinic because they're out there doing outreach work. So I think mainly through community partners is the way we get the print ones out, and they're always free. I'm going to a comics festival in November, and we'll have a table and we'll give out free comics to reach a different kind of audience. Schools, school health programs can be a way. But digitally actually is probably where we get the most traction.
That's really, really good to know. That's a great it's a big difference. I mean, it's one of the reasons that I mean, you and I were talking about it at the outset. One of the reasons why maybe the public health comics are taking off is because of Instagram. And one of the other questions, Meredith, that a number of people are asking in the chat, and I think would be important for a couple of people who are saying they want to do this in their county or state is, do you have any suggestions on how to reach out and build bridges to artists if you don't
Yeah.
want to be the person doing the illustration? Do you have any suggestions for that?
Yeah, so I have to say, that I'm fortunate that I live in a city that has a very large independent comics community. And I was able, I think I first made contact by looking at, there were comics at the time back when we had more print newspapers, the Alt weekly newspaper. And, I saw some comics work and I contacted that person and he put me in touch with somebody else. And that's how I kind of made my first contact. I think that there are comics festivals around the country, independent comics festivals. Some of them, like Cake, is the one in Chicago, I believe, and anyway, that there's a lot of artists who are there, and you can talk to them. I do find that it works best to work with people who already work in the comics medium.
Yeah.
So I tend to work with these independent comics artists who their style is different than, say, like a DC or a Marvel comic strip, and I like that. I think it invites in people who superheroes don't appeal to. The big comic book houses sometimes will do commission work, but it's very expensive. So I think you could probably do internet searches. You could go through graphicmedicine.org and reach out and see if there's anybody who's interested. I know it's not the easiest thing to do to find the illustrators. There are people you can also look for illustrators who are professionals in your area, and some of them might also do comics. And there's a lot of young people who grew up reading manga and other comics who are very versatile, so checking out through art schools in your area too might be a way. I will say too that there are ways in which, as an entry point, you can use photographs, right? And they're used a lot in Spanish-speaking countries as a way of communicating information but what I would say is that you really have to be thoughtful in how you set up those photographs. And I would still script it and storyboard it out and really make sure that the picture has all the information clearly in terms of a visual that you need, so that you have the right expressions on people's faces, that people can very clearly see what's happening, that it's well lit, all those things, because, but it's a way in which you can use the photograph and then use the same narrative and dialogue bubbles and stuff to do comics work without doing drawings.
Yeah, that's a great suggestion too. You mentioned that if you use like a big comics house, it might get very expensive. And of course, there are a lot of questions in the chat about how you justify the budget. Is it hard or easy to get a budget to do something that seems like it might be time consuming, like making comics?
Well, when I started, people in my department really didn't understand why I wanted to use comics. And so it was initially hard to get greenlit
Hmm.
because I think people made assumptions that comics were about superheroes or they were a children's medium.
Right.
But there was somebody in our department who understood what I wanted to do, and she helped me find the grant money
Great.
to do it. And I will say the comics illustrators, sometimes to their own detriment, undercharge. So sometimes I will actually boost their rate because I think they don't know what other illustrators are charging.
Oh,
But in terms of illustration work, sometimes it's less expensive, but I would encourage always compensate the artist
of
and
course.
compensate fairly. And yeah, but once it was kind of like proof of concept, like it took a while. It was a slow, I started in 2008 and it took a while. I think comics are now much more in our culture. We talked about this, Heather, about how, like once you start seeing them in NPR and the New York Times and JAMA, that people's attitudes for comics really have changed. But also it's the rise of Instagram and other platforms that are highly visual where you need visual content. And so now I will say that my supervisor really understands how well this works, and he was somebody who didn't really get it at first, and now is an evangelist for me and goes around, and when he meets with programs at our department, he says, "Have you considered comics? You should create budget for that."
That's
And write that in,
great.
we have a lot of grant funding in our department, and so building that in.
That's fantastic. I'm so happy to hear that you have converted. Is there anybody in the room that wants to turn their microphone on and share a response or ask Meredith a question? We have time for one or two. All right. No, go ahead.
Hi, this is Julie Barrett at Mass College of Art. I am so blown away by your presentation. Thank you. I also wanted to mention, actually, Harvard Medical School is looking for people to work with. They did a program called the Medical Inclusion and Diversity Art Program. They're assessing all the textbooks and materials and lectures and images that are used to train doctors right now and inform patients. So all through illustration and graphic medicine. Um, I'll send along a link to them, but it sounds to me like, you're saying how important that is, and Harvard Medical School is leading studies on this stuff right now, and they would, I'm sure, I don't work for them or anything, but
Right.
I'm sure they would like flip if they got to talk with you. So thank you so much for this today. And Lisa Kennedy at Mass Art is also a professor who's now the chair of the illustration department working in graphic medicine. And it just sounded like a lot of conversations, these learning opportunities for students to practice their illustration and people who want
Mm,
illustration to have happen. this is fantastic. So thank you so much, Heather, for putting this all together and for the talk.
Yes, of course. Thank you for coming, and thank you for adding these very, very interesting resources that I'm sure people will be following up on. It's great to see you. I think, Meredith, we'll end with one more quick question for you, and then anybody else in the in the chat. Somebody's looking for graphic narratives related to overdose prevention work. You know about any of
Yeah.
those?
We've actually done some, it was a while ago, but about safe medicine return, which is it's a small part of overdose prevention. It was a campaign called Don't Hang On to Meds, in which we told stories about people who, you know, we have a story like of a young person who started taking medications because she was having, sort of a mental health crisis, and started taking medications from other people's medicine cabinets, and and how that started her with her substance use disorder. And then we also talk about other reasons why people might want to return their medicines. It was basically, part of overdose prevention. So somebody who worked for a poison control center, who took a lot of calls from people who were overdosing, and why it's important to get those medications out. But I think we are talking about doing some actually in the next year or so, that are stories about, there's a lot of pushback against harm reduction. And I think a lot of misunderstanding about what harm reduction is and what its value is. And so we want to do some stories about people who benefited from harm reduction and got into treatment, so that people can start to understand, that why it's important to, take people in as they are, and then work with them moving
Yep.
forward. So, but I will ask around to see if anybody knows that. Actually, there's a really great artist in our area. Her name is Tatiana Gill. And she's just an independent artist. I've worked with her. She was the one who did the Don't Hang On to Meds work with us. And she just does her own independent comics. And she's done some about needle exchange. She's done some about the importance of safe injection sites. And she's done some great overdose prevention work that she's had published through some of our independent media outlets here.
Perfect. Well, we'll be looking that up. Okay, out of respect for everyone's time, we're going to leave it there. The resources and the recording will absolutely be published. It takes us a couple of hours, but they will get there. Thank everybody for coming. This community that is so supportive and still like one of the good places on the internet is means the world to me. So thank you for coming. You can see the upcoming schedule at the link. And Meredith, it really has been informative, educational, and fun all at the same time. And I really appreciate you joining us.
Thank you. I really enjoy the warmth of this community. We need more places like this.
All right. Take good care of each other and yourselves, and we'll see you all later. Bye, everybody.